afternoon, everyone, and welcome to today's PHO Rounds presentation on Vision 2030, Moving Data to Public Health Action. My name is Dr. Jessica Hopkins, Vice President and Chief Communicable Disease Control, and I have the pleasure of moderating today's session. I would like to recognize that we are situated across many lands. I am currently located in Toronto, which is the traditional territory of many Indigenous nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. This territory is covered by Treaty 13, the Williams Treaties, and the Dish with One Spoon Wampum Belt Covenant. I'm thankful for the opportunity to work on this land and continue to work to build respectful and meaningful relationships with Indigenous communities and organizations. I will now mention some housekeeping items. To ensure an engaging and optimal experience for all, the Zoom chat and audio-video features have been disabled for this session. Please feel free to submit any content-related questions in the Q&A function at the bottom of your window. They'll be addressed during the discussion period. If you have any technical issues, please email capacitybuilding@oahpp.ca. It's now my pleasure to introduce the speaker for today's presentation, Dr. David Buckridge. Dr. Buckridge is a professor in the School of Population and Global Health at McGill University in Montreal, where he directs the Surveillance Lab, an interdisciplinary group that develops, implements, and evaluates novel computational methods for population health surveillance. He also directs the Research Data Warehouse at the McGill University Health Center and is an associate member with MILA. As a clinician scientist, his research and practice focus on the informatics of health surveillance and disease control, and he holds a Canada Research Chair in Health Informatics and Data Science. He is currently the Executive Scientific Director of the Science and Policy Integration Branch at the Public Health Agency of Canada. Dr. Buckridge has an MD from Queen's University, an MSc in Epidemiology from the University of Toronto, and a PhD in Biomedical Informatics from Stanford University. Welcome, Dr. Buckridge, and thank you so much for being here.
Thank you very much for that introduction, Dr. Hopkins. It's my pleasure to be here and be with you, all of you today, to share some findings from this work, our efforts to develop a vision for public health surveillance in Canada by 2030, as you can see, titled Moving Data to Public Health Action. I'll start myself with a couple disclaimers and declarations of interest. So just to remind everybody, this presentation was created by myself and colleagues at the Public Health Agency, and the Public Health Ontario is not the owner nor assuming any liability for the content of this presentation. Myself, in terms of interests, I don't think any of these constitute conflicts, but just to be transparent, I'd like to present my employers, research support, and where I'm also a board member. This is, in fact, my first day after working at the Public Health Agency on an interchange for a couple of years. So, in fact, I'm now just a very fresh past employee of the Public Health Agency of Canada, but still a delight to share with you this work that I did in my capacity there while I was on interchange. Okay, right, let's then just quickly talk about the learning objectives. So what I'm hoping that everybody here will take from this webinar today. First of all, I want to describe, how we came up with this vision, what the work that we did, the inputs, and the methodology that we used, because I think it's important that everybody understands the effort and the approach when they're looking at the actual vision itself. Then, of course, I want to talk about the vision components. So what it is, the vision, what are the other elements of the vision, and really focus on this concept that we've called a system of systems as a way of describing how not only individual surveillance systems should be in terms of a vision, but how the collection of surveillance systems in the country should work together. And then finally, because we want to be very action-oriented, we also came up with a set of what we called opportunities for action, which are ways really to try to move towards the vision. And so I also want to spend a fair bit of time presenting those so that you can hear about those opportunities and reflect on those in your own context. Okay, so first of all, just to start out with how we went about developing this vision. In fact, before I describe that, though, you can see on the right the cover of the document, the PDF version of the vision, and then a QR code that will take you to a downloadable version and an online version of the vision. So it is published and it's available. It was published in the spring of 2025, and it is accessible. So you can obviously not read it as we go along, but certainly you can refer to it afterwards if you want to go deeper into any of the topics that I raise. So why do we do this? Well, Canada had not really published a vision for public health surveillance since 2016, so almost 10 years ago. And of course, a lot has happened since then, most notably the COVID-19 pandemic, where many lessons were learned, but I think there was a bit of a concern that those lessons maybe weren't being gathered and integrated into where we want to go in the context of public health surveillance. And so that was certainly an important impetus here. And also, there's been a change in the landscape, beyond just the pandemic, many new and reemerging health threats, new approaches to data governance, which we'll touch on a bit more in the presentation, novel data sources, technologies, all sorts of things, including artificial intelligence. So, in the context of that changing milieu, it was felt very important to have a refreshed vision for public health surveillance. And other countries, had had similar experiences and had already moved in this direction. And so, of course, we kind of engaged with some of our colleagues in other countries to understand where they were going, and that framed a little bit of our approach. I'll get a little bit more into the methodology and so on in a subsequent slide, but what I think is important to know is how we really wanted to situate this vision. So, it was not meant to be a top-down exercise with the federal government working primarily with their provincial contacts to create a vision that everyone else should sort of agree to. The idea really was to almost be more bottom-up, meet with people working in surveillance, look at the literature, talk to international experts, of course, also consult with people at the Federal Public Health Agency and within provincial and territorial health authorities, but really try to, access and capture the experience and the expertise of people working in public health surveillance from many perspectives. And so the goal then was to be, bottom up in this way, and not to necessarily be developing a vision that everybody would have to sign off on and agree this is exactly where we're going. It's meant to be more aspirational, inclusive, non-binding, as I said, but action-oriented in the terms of trying to really come up with what are the ways that we can move forward in these opportunities for action. So that was really kind of the framing of what we wanted to do. And part of this was just to make sure that we really did get this expertise from the ground, but also to make sure that we were going in a direction that everybody that we spoke with would agree with. And fortunately, there was a fair bit of consensus as we moved along in this work. Okay, so the approach, I'll sort of give you an overview here, and then we'll jump into more detail on some of these bits as we go along. But really the core of what we did was to engage with a lot of people working in public health surveillance through in-person consultations and online. Then we commissioned a lot of supporting information. So rapid reviews, and I'll describe one of those in a second, a number of literature reviews, including some done by our supporting partners at the National Collaborating Center for Indigenous Health. We had summaries of discussions from the consultations. We co-hosted what the Canadian Institutes for Health Research calls the Best Brains Exchange. We invited experts from around the world to discuss the topic, and those responses were also recorded in a report and fed into this report. And then finally, what we also created was an expert roundtable, a surveillance expert roundtable, including it with Dr. Hopkins was very kind to sit on that table for us. And that helped us to really synthesize a lot of the information that was coming back to us, both to pull out the challenges, but also to identify through a Delphi process these opportunities for action I mentioned, which I'll come back to in a few minutes. So this just goes over a bit more some of the documents here you can see. So there was, as I mentioned, these commission papers by the National Collaborating Centers, including a rapid review of methodology, which I'll talk about on the next slide. The best brains, and they made a number of presentations at different conference venues. And as I alluded to or mentioned on the prior slide, we're also preparing an academic paper that really pulls together sort of the core of the methodology and the findings and adds a little more discussion in that context to build on top of the report. So this is an infographic from one of the rapid reviews I mentioned, which was completed by the National Collaborating Center for Methods and Tools, which is based at McMaster University. And they did a review of the literature from 2018 to 2023 looking for published surveillance innovations, sorry. And of course, this was during the context of the pandemic, so highly influenced by that. And this Sankey plot that I'm showing you here, the text is quite small, so you may not be able to read it, but just so you can follow how this works, it starts on the very left where they start with the kind of broad categories of surveillance. So the big gray bar you can see is infectious diseases. So perhaps not surprisingly, most of the surveillance innovations in the published literature were in that field of infectious diseases. If you go to the second sort of vertical line, you can see the specific types of conditions. So the infectious diseases break up into different infectious diseases. And the biggest blue bar there is COVID-19, again, not surprisingly. And then the next two lines are flowing from there into what types of methodologies were noted that where the innovations occurred. And you can see I've highlighted some of the bigger areas there, which given your experience for many of you during the pandemic, it's probably clear how these things were quite important in that context. So point of care testing, digital surveillance, genomic surveillance, and of course, wastewater surveillance that saw a lot of interest and energy during the pandemic. So I think one caveat here, which is really important, is even though this is very excellent work, these are published innovations. And as many people probably realize, much great work happens in public health that doesn't get published. And so this is perhaps not a fully representative view of where innovations are happening. And of course, that's important to remember, but this is one take and was one piece of input to our work. More generally, when we look across the landscape and the trends that we saw that were really shaping the future of public health surveillance, some of these overlap a little bit with those areas you saw before, digital transformation, for example, digital tools in surveillance. Global public health surveillance is obviously much more in the fore now, given the pandemic, but also just the need to have that ability not only to look locally, but also look globally and understand those connections that can occur quite quickly. New sources of data, we noted. Again, genomics, I mentioned, wastewater surveillance. There was also a lot of work in seroepidemiology and serosurveillance, many possible areas there. And it's sometimes hard to separate the new sources of data from the new tools because often we're using new tools to generate new types of data. So understanding that dynamic and what that means for surveillance was also, I think, really important in the context of this work. So just coming back then again to these consultations I mentioned, we really did do a lot of work to make sure we could reach and listen to pretty much anybody who wanted to contribute their comments or their insights about public health surveillance. So as the map shows, we had consultations in every province and territory across the country of Canada. These were 29 facilitated engagements. We had almost 2,000 or 1,700 participants. That's including people that were at these in-person or virtual consultations, but there was also the opportunity for people to comment through the canada.ca website and enter their commentary directly into that website, both for the general public and also there's a separate branch for people that had expertise in surveillance that went in a slightly different direction and asked slightly different questions. So lots of inputs. And in these consultation sessions that I mentioned, the in-person and virtual consultations, which were skillfully mediated for us by the National Collaborating Center for Infectious Disease and colleagues, also from the National Collaborating Center for Determinants of Health were also involved. They asked these questions. So, what were challenges and solutions that people were experiencing in public health surveillance? And we'll come back to some of those challenges in a few minutes. Also, not just the challenges, but what were elements of success? So what were they seeing that was going in the right direction, but really needed a bit more resources or a little more direction to really see their value? And then based on that, how did they see the future? So what was their perspective on vision? And then a bit more of a scanning component of, what's going on where they are in other places and more generally. Um, as you might expect, we did generate a lot of challenges. People are kind of, it's easier, I think, for everybody to see where the challenges and the barriers are in their environment. But we did try to coax out of people really more that sense of where the opportunity is. And again, you'll see those come out a little bit later. Okay, so what came out of all that? This is kind of really an overview of really a very detailed qualitative analysis that was conducted of all the information that came back to us from these different consultations, from the reports, from the reviews, and from the other sorts of sessions I described before. And what you see in the center is this, surveillance 2030. And then the main challenges that really came out, you can see in the darker circles. So starting from the top left at about, I guess that's 11 o'clock almost, you can see the purpose and governance of surveillance. And then going clockwise, partnership, collaboration, and engagement, strengthening First Nations, Inuit, and Métis public health systems, strategic use of technology, tools, platforms, and methods, data quality, access and use, workforce competencies, training and needs. Now, none of these challenges are particularly novel or shocking, and in fact, we refer to them as persistent challenges because many of them have existed and been documented in previous reports. So we did want to document these, but as I said, we also will move to look at some opportunities in a moment. But I think it's important to understand these challenges. So I won't go through each of them in great detail here because we do have some subsequent slides to describe them a bit more. But as you can see, if we just take a look at the purpose and governance of surveillance, which is the one at around 11 o'clock, you can see that there are a number of elements of that. So people, commented about the need for data governance, obviously, clarity on roles, who's doing what in a surveillance system and across surveillance systems, and what are their responsibilities, aspects of measuring performance and progress, the sense that we do evaluate periodically surveillance systems, but we're perhaps not as good at monitoring them in terms of their ongoing continuous quality. What are the politics and the policies around that surveillance system? And finally, the perception and reputation of surveillance. So really a lot of richness to unpack these challenges, which I think is important. And recall that these are not one-off comments. These are, there was sufficient input around each of these areas to coalesce into kind of a sub-theme, if you will. And that's what those bubbles around the different challenges suggest. And so, again, I won't go through each of these in great detail. These slides will be made available. And this, of course, is documented in greater detail in the report. So the first one, I was actually a little surprised by this one, to be honest, how much it came out and we heard this in a lot of consultations from people, comments like, I do what I, do every day in surveillance for the system I work in, but I don't really always know why I'm doing everything, or my sense is it's not necessarily that we're always doing what we need to do. Sometimes we're just doing it because we always did it that way. Comments like that were not uncommon. And so, given the importance of public health surveillance, the fact that we have so many conditions that could be under surveillance and that are under-resourced, I think it's really important that we think about what we're surveilling, how we're doing it, and that everybody involved in the enterprise of conducting surveillance or being part of a surveillance program or system understands why we're doing that and what their role is. And overall, when we think about the not just individual systems, but public health more generally, that we have a reasoned and rational frame for what we're conducting surveillance of, what we're not conducting surveillance of, and everybody more or less agrees and understands. So that's a fairly high bar to get to, but I think that's a good place to aspire to be in terms of this particular challenge. The second challenge, partnerships, collaborations, engagement. Uh, as we were in fact doing this work, the World Health Organization came out with a really good report on collaborative surveillance. And if you have not read that, I encourage you to take a look. Definitely puts an emphasis on this particular challenge, and they suggest also some opportunities that align with some of the ones that we suggest. But here, it's really just being clear that there's clear relationships between all the actors that are involved in surveillance um, across jurisdictions, within jurisdictions, and there's relationships built on trust, meaningful engagement with some degree of feedback. So that's really what we're hoping to see in terms of this challenge. Challenge 3, which again, many of you commented on, data access, quality, and use is a very common one. The challenge you can see on the left, which probably resonates with you, that's how it was framed. The word siloed came up very often, outdated, fragmented systems. And really what we're trying to get to is effective data management. That requires obviously common data standards and processes at some level. And the Pan-Canadian Health Data Strategy, which occurred around the same time as our work and finished up just a bit before we did, put forward a Pan-Canadian Health Data Charter and targets in this area that I think have been really quite helpful in providing some clearer guidance for the country there. But really we need to get to a place in public health and public health surveillance where we not only have effective data management, but we have a shared understanding of important standards that are implemented across systems and jurisdictions to allow really, not only data, high quality data, but also sharing of those high quality data in a meaningful way. Okay, strategic use of technology, tools, platforms, methods. There are gaps here, obviously. Some people talk about the technology debt sometimes in public health settings. I think it varies a lot depending on the public health unit or environment that we're in. But really, there is an important imperative here, I think, to improve the quality and the utility of the tools that we have at our disposal. Not, of course, denying that there are challenges in this space in terms of, what these systems should look like, what the business model is, how public health organizations can procure them, all these kinds of things. But really the goal is to move to a more kind of, flexible and agile digital environment where we really have, effective and equitable implementation of these kinds of tools. The fifth challenge, workforce competency trainings, as we saw, did not get a lot of votes, but it is an important issue. In fact, there was, at the same time we were doing our work, an effort to renew and rebuild the public health competencies for training. And that came out and has been released, those updated refreshed competencies. But again, this is a kind of a moving target in many ways, as I think most people realize, given the pace of change in technology and all the things that we've talked about before. We really need, new trainees coming in that are skilled in these approaches, but we also need ways to train people currently working in public health, and not just people working at the coalface with the systems. Also, leadership, senior leadership and management needs to have that understanding of, for example, future tools, digital technologies, AI, so they can set a framework for where they want to go with that. And then finally, challenge 6 about building respectful partnerships with First Nations, Inuit and Métis peoples, communities, and organizations. This really recognizes the limited capacity to monitor health and well-being by First Nations, Inuit and Métis peoples for themselves. And this is not just about those communities. It's really about the broader public health community and how we work together to address this challenge. And we have a number of, in fact, opportunities for action that address or attempt to address this challenge. So that's a really quick run through those 6 challenges. As I mentioned, they are all in the report in much more detail. And so please feel free they're actually a little more towards the end of the report because we wanted to really focus on the opportunities in the main body of the report, but they are in the report and you can see them built out in more detail if you're interested in going through those and unpacking some of those challenges a bit more. So now I'd like to just move to the vision. So this is the vision statement. And as you can see, there's the words that are in bold here. We're talking about adaptive and collaborative public health surveillance. And as I mentioned before, we're really focusing on this concept of system of systems. And I'll come back to that a bit more, but essentially it really means it's the set of surveillance systems that we have in the country. So it's a bit of a notional thing. We want not just individual surveillance systems to be adaptive and collaborative. We want this overall system of systems to be collaborative and have interoperability, not between every public health system and every public health system. That's not what we're talking about. But the idea that where appropriate, public health surveillance systems within and across jurisdictions are able to interoperate either by exchanging data as inputs or information as outputs that can really facilitate our goal of timely insight for action to improve health, reduce inequities for all people in Canada. So that's the vision statement. Of course, there are other aspects of the vision that are outlined in more detail in the report. One is these desired states, which, as you can see, kind of come back to and reflect some of those challenges that were raised. So, we really want to have unified purposes and governance. I mentioned this before, so everybody's clear on what we're doing, both within systems, across systems. We want to see inclusive partnerships, a well-supported workforce, integrated health information, operational efficiency. So these are all aspects or states that of a really high-functioning public health surveillance system of systems in Canada that such a system would have these states. I want to, though, come back to the system of system concepts because it might be a bit new for folks. This diagram was created to try to further illustrate what a system of systems implies. So every tiny little circle you see inside the big circle pardon me, and there's one of them is blown up to show you in the black outline, is intended to reflect a surveillance system. And so within that surveillance system, you can see the usual cycle of data collection, data management, analysis, interpretation, information dissemination, public health innovation, knowledge mobilization. And it really is a cycle. It's not a linear process and it's not always directly, one after the other, but that's the process that we expect to see within an individual surveillance system. And then what you're seeing in the circle on the far left, where those smaller circles are embedded, is that those individual systems, we can expect some of them may interoperate within different jurisdictions or areas. So for example, the blue area might be a province, the red area might be the federal environment, and green could be other stakeholders involved in public health surveillance, like other federal organizations, for example, or a First Nation, for example. And we expect to see interoperability within those systems at some level, but also across those environments. And of course, we're constantly bringing information in from the communities under surveillance, which are shown on the outside of the circle, and we're constantly pushing back out information to those communities so that we're actually appropriately engaging with communities, not just for data collection, but also for interpretation of what's coming out of the surveillance process. Now, of course, this kind of a arrangement is not going to arise just by happenstance. If we want to come to such a system of systems within the country, we need governance that has to not, the governance that clearly recognizes the independence of every surveillance system within this larger system of systems, but adds a layer that supports how they might or how they should or could interoperate when appropriate. Of course, interoperability does require technology standards. More importantly, though, it also requires what I refer to as the value proposition being clear. So, for example, a local public health department and a provincial public health department or public health agency are going to operate in certain ways defined perhaps by legislation or in other senses, but to operate across jurisdictions requires a very clear sense of why. And that's what I mean by value proposition. And that value proposition for interoperating or collaborating in such a way may be different for different stakeholders, but it needs to be clear. And then what I'm just listing here on the right, you can see is just indicating that such an approach, which can be thought as a federated system of systems, is very well aligned with the Pan-Canadian Health Data Charter that I mentioned earlier that came out of the work that was done to try to define more generally what's the approach to really making good use of health data in Canada. It's obviously, I think, well aligned with the political federation in the country of Canada. It is supportive or aligned with also Indigenous data sovereignty because this recognizes that Indigenous groups such as like First Nations could have their own capacity to conduct surveillance under the OCAP principles, could own and control their own data from surveillance, and could permit others to access or use those data in a clear governance framework that they support. So, and I think as I mentioned before, consistent with this WHO concept of collaborative surveillance. So this we think is kind of a useful model. It's not fully developed, I would admit, but we think it's a useful way to put a bit. Okay, so that's the really the vision and the challenges. And now I want to sort of switch gears and move to the opportunities. So what we're showing here is on the left, those 6 challenges that I mentioned before. And on the right are 10 opportunities for action. So we came up with these 10 opportunities through a modified Delphi process, working with our surveillance expert roundtable, where they looked at a lot of the opportunities that had come out of the discussion and the different sort of, venues and types of information we collected. And they tried to look at these opportunities. Some of them had to be pulled together and coalesced, because they were similar, for example. And then vote on ones that were feasible. So there was some evidence that something was happening in this space, and they were likely to have impact. So, they were already going on, could go faster, or it could scale in some sense, and would likely have an impact in terms of addressing one or more of those challenges. And I should note, and you can probably see just from looking at these, that there's not a one-to-one mapping from the key challenges or the challenges, sorry, to the opportunities for action. It's really more of a many-to-one in the sense that some of those opportunities are going to address more than one challenge. So I'll just go on to the next slide here so you can get a better sense of what these opportunities are, laid out a little larger in their words. Again, every opportunity would go into in much more detail in the report. So maybe I'll just stop for a few of them then, just to talk about some of these opportunities. So starting with the developing governance frameworks. I mean, this is one where I think it takes some initiative. Within an individual system, it's one thing, but when you talk about across systems, it really requires some initiative, as I mentioned, for those different system leaders to come together. One example that we do talk about in the report is the chief coroners, chief medical examiners, and the public health collaborative who came together, really bringing a lot of groups together around vital statistics to try to improve that really critical aspect of public health surveillance. That's one piece we talk about in the report, but I think there's a lot of different ways we can move forward with this, both within, as I mentioned before, individual systems and across systems. Yeah, this one, which I was intrigued to see that there was strong support or a number of votes for this one in the poll we just did. This was interesting because this came up a number of times where in our consultations, people said, I just really find it hard to account for social determinants of health in my surveillance system. I know the data exist, but it's a really heavy lift to get them linked and accessible in all the different systems we have. And this is in my mind a bit of a low-hanging fruit because we have at the area level anyway very good data in terms of social determinants of health, and we ought to be able to make those data really easily available for everybody working in public health surveillance in a constant, clear, coordinated and systematic way so they can be linked and brought into their surveillance systems. I think what's harder, of course, is at the individual level. And Canadian Institute for Health Information has started to put forward standards, and I know there's been work in other places, including in Toronto, for race-based and Indigenous identity that can be used to really help to understand some of those determinants and how they relate to health status. So I think this is an area where we could make great strides in Canada to really, make these data much more accessible, better structured, and consistently structured across all of our surveillance activities so that we really are able to drill down on pretty much anything that we do in terms of social determinants of health, ideally both at the individual and area level. Number three, this is also, I think, a critical area. I won't say a lot about it just because I can't speak about everyone. I want to make sure we have time for questions. But one example that we do note here in the report is an effort that's happening in Quebec, in the province that I'm in, where the government's put forward a fairly, I think, a good interministerial collaborative plan around AMR, antimicrobial resistance, and One Health that brings together a lot of the stakeholders and communities involved in that space. Okay. Yeah, we have three opportunities that relate to surveillance by First Nations, Inuit, and Métis within Canada. The first one's really speaking to the issue around health data sovereignty. As I mentioned, I think the federated approach is quite important for that. But there are other things that can be done, including activities such as, or not activities, institutions such as the First Nations Data Governance Center and others that are really pushing forward in this space. And we have a number of very good examples in the report. And so I won't speak to this one right now. I will speak a bit more though to the second one here, opportunity for action number 5, which is about enhancing the capacity to conduct surveillance in a manner that values, strengthens, and incorporates First Nations, Inuit, and Métis knowledge and skills in public health assessment and response. And this is not only by any means about just Indigenous communities and peoples. This is about the whole surveillance enterprise, because I think what I learned really in this process is that there's so much to learn in both directions, both in terms of cultural safety and how the rest of sort of the, I would say the sort of more the governmental public health surveillance system works, but also just in terms of the perspectives around surveillance. One of those reports I mentioned that we had done by the National Collaborating Center for Indigenous Health was a number of stakeholder interviews with experts in Indigenous public health surveillance. And one thing that really came clearly to me through that, and I really encourage you to look up that report and read it if you haven't already, is the need to really understand how in that example, First Nations communities or peoples that were interviewed certainly see surveillance and how it's seen in a more kind of Western scientific way. They're obviously quite different. In a Western scientific perspective, it's really often about statistics and numbers. And from the First Nations perspective, what I took from their comments was it's really, they're really much more interested and focused on the local situation, and 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 the numbers, and sometimes you really take away the meaning and the value is what is there. And so how you bring together that really grounded understanding of what's happening, and often in a more qualitative sense, and how you incorporate that with a more sort of quantitative approach into a surveillance system that really is, seeing with different methods, really, I think is a challenge for us, but is really an interesting direction to go into, and one that we need to go towards. I think the question is, how do we get there? Okay, opportunity for action number 6 is about more about investing in First Nation and Métis health information system infrastructures and indicators. There is some work done here. There's been some surveys. I also already mentioned FNIGC, which is active in this space, but also a number of other surveys that have been put forward. So I think momentum is building, I would say, to address this particular opportunity. Workforce and development, I won't say a lot about this one other than that, as I mentioned before, we have these new competencies. I think putting them into practice is now the challenge, understanding what that means for continuing education and also for schools of public health. Opportunity for action 8 is an important one around interoperability through data standards. Sometimes it feels here like we're trying to boil the ocean, like we have to change everything. And the Pan-Canadian Health Data Charter is one example of a broader strategy framework around this. But I do think there's a lot of room for movement here within individual organizations, public health organizations. Obviously, we do this ideally somewhat coordinated across the country because we want these systems ultimately to be interoperable. But really just focusing on key concepts like social determinants of health, like diseases, like geography, and just ensuring we have real rigor about how we encode those systematically across all of our surveillance systems can reap very large benefits, I think. And we're starting to see some of that activity already. Certainly the Public Health Agency is starting to move a bit in that direction. And so I think this is an opportunity that really we can move on, and we are moving on already. Number 9 here around reviewing mechanisms for data sharing and linkage. So interoperability can't occur unless there is some agreement around how data can be shared or at least accessed across systems in a federated way. And there has been a fair bit of work done in the past. We've generally had in the past, I would say, regulations and things that are quite rigid and often quite detailed. The challenge here is to get to the level of clarity that we need under legislation, but have agility and flexibility. And there is work going on in this space. Public Health Agency of Canada and many of the provinces and territories, and all the provinces and territories, in fact, are working together through the Public Health Data Steering Committee, which is a federal, provincial, territorial, indigenous table for really looking at some of these issues around data sharing and linkage, particularly the renewal of the multilateral information sharing agreement, which I alluded to before. And then finally, modernizing data infrastructure. So we need to continue to modernize data infrastructure. There were many platforms created throughout the pandemic. As I mentioned in the past, genomics for wastewater surveillance, serial surveillance, and so on. What we really need, I think, now is a clarity in terms of what platforms we want to have, what are core platforms, how we want these to interoperate, and what's the business model in public health for all of this. It's very challenging to support data infrastructure. Very challenging, particularly when we do it in silos. But if we can do it in a collaborative way, I think there is great potential for us here, but we need to think about how we can make that happen. Okay, so that was a real whirlwind tour through those opportunities. I hope that was helpful to get a little bit of color around those. And as I mentioned, they're in much more detail in the report if you want to dive into them. Where is the Public Health Agency going next, and where generally should we be going next in terms of Vision 2030? Well, we're doing a number of activities to do knowledge mobilization, including, for example, this webinar. As I mentioned, we're preparing a manuscript. The Public Health Agency of Canada itself is really into operational planning now in terms of how do the activities that the Public Health Agency leads and is deeply involved with in public health surveillance align with this vision. So that includes looking at things like how the systems that are at the Public Health Agency progress against minimum performance standards, I mentioned the modernized data sharing, and of course, looking at how the agency can really have a more centralized and flexible way for data intake to take some of the strain and the load off public health partners. And then, of course, identifying ways to continue to engage with provinces and territories and others through some of the tables I mentioned, and of course, periodic updates. So I think I will just now move to the final slide I have here, right, which is just to remind you about how you can access the report. And then finally, some acknowledgements that I just want to make. I mean, a lot of people have contributed to this. That includes everybody who was at these regional consultations, the public consultations, the surveillance expert roundtable members, the National Collaborating Centers for Public Health are very involved, and of course, many colleagues at the Public Health Agency and Health Canada. So really, thank you very much for your focus and your attendance at the webinar today. And with that, I'd like to pass it back to Dr. Hopkins, who I think will be able to take some questions for us.
Thank you so much, Dr. Buckridge, for the presentation. I mean, you've really summarized nicely, I think, two years of hard work to really hear from voices across Canada on the vision for surveillance. We're now going to move to our Q&A portion of today's session, and we are taking questions from our live audience. So for anyone who has a question, please go ahead and enter that into the Q&A pod. While we're waiting for people to get started, I wanted to pick up on your last slide where you talked about the knowledge mobilization portion of this. Many of our attendees on today's webinar are from local and provincial public health, particularly here in Ontario. And I'd be really interested in hearing from you about what you see as some of the opportunities and ways that we might be able to help to move this forward.
Thank you. Yeah, it's a good question. I think part of the challenge with these kinds of exercises is you end with these reports, and then everybody's like, well, that's great, but what do I do? Like, what do I do today or tomorrow? So, I, I think it does involve an organization. I mean, it's hard for one person to make the change we need to see. So it's really, but I think the smallest unit here probably is a surveillance system or program. And I think and we've already heard, in fact, from some of our partners and some people that are participating in the process and others that they've started to take a look at, their program or their system, or even more at an organizational level at their strategy. And they take a look at the vision and they say, okay, so, in terms of these opportunities and these areas that we need to see change, how does that map to what we're doing? So a little bit of almost like a strategic analysis or a gap analysis, maybe. And I think, again, it's helpful, I think, for that to happen at the program level, but really to get momentum, you need to, I think, have that probably happening at maybe across programs or within organizations. So, perhaps as part of a program review, for example, programs could look at what they're doing and how it relates to the vision, and come up with some priorities internally that really, they think can get them towards some of these opportunities, or maybe even not the opportunities we describe. Maybe there's some different ones, but they move them towards that vision where they're moving their system towards something that has those characteristics in terms of the clear governance. How can we improve our data standards within our system? How can we better engage with the community and the work that we're doing? So I think it creates a bit of a framework. It doesn't contain all the answers, and in fact, we very clearly tried to stay away from being overly prescriptive, because we've really recognized that although we share a lot of challenges and there may be some common opportunities, there will be a lot of differences from system to systems and within organizations too. And so, it really requires some degree of internalization, which I know is not always easy, but that amount of reflection, I think, is necessary to kind of move forward.
Great, thank you. We have some questions coming in for our audience. The first one is, what does success look like for Vision 2030, and how will this be evaluated?
Great question. It's, as I said, it's not a prescriptive thing where we're going to, hold people's feet to the fire. It's really meant to be one where, we show kind of where we'd like to get to. And then through different processes and through different tables, we're going to try and agree on some aspects of that and move towards it. So, visions are supposed to be somewhere between, exciting and achievable. So, you know, I think there's a little bit of each in this one. I mean, 2030 is pretty soon. It's only 5 years from now, right? So, you know, we have to be realistic about what can be done. I think in my mind, you know, success is to me as much about getting people on the same page about where we are and even some elements of where we want to be, and identifying some of these key opportunities we'd like to push on. So, you know, some of these I think have already, you know, one example I'll give, this concept of, you know, data standards and interoperability. You know, the Public Health Data Steering Committee is supporting a project between the Public Health Agency, Ontario, and British Columbia around immunization data exchange, which, you know, I think was somehow informed and influenced by some of what happened here. So projects like that, you know, that's a sort of a higher level project, I would say. But, you know, to me, success is going to be a number of those projects that we can point to and say, this is really moving in the direction of what we described. And ultimately is going to strengthen our overall surveillance activities in the country.
Yeah, I think some of the power in the vision too was just how much consultation was involved in developing it. There is a large number of people from across the country that really felt that these issues were important to address, and hopefully that will translate through those tables and ongoing work. Our next question is, in terms of social determinants of health, were non-health federal partners like Immigration, Refugee, and Citizenship Canada involved for health surveillance of temporary workers, migrants, and so on?
Just make sure I understand the question. Were they involved in our consultation or were they involved in those surveillance activities?
I think probably the consultation. I'm not
Yeah.
sure if the questioner would like to clarify, but I think maybe start with the
Yeah.
consultation process.
Yeah, so we had a number of interactions with federal agencies that were, and we cast the net fairly large, obviously, because, okay, thank you for the clarification. Yeah, good interpretation. So, um, you know, that almost goes back to that comment I made a little bit in the social determinants of health data, which is there's the richness of data available at the federal level is quite impressive. The challenge is getting it into the hands of people that do surveillance in an efficient, sorry, and accessible manner. And so, you know, we worked quite a bit actually with groups like Statistics Canada, for example, to understand what they were doing and try to understand how that, I mean, obviously there's a lot of back and forth already between the Public Health Agency of Canada and Statistics Canada. It wasn't like it was the first interchange, that exchange that we had, but you know, as an example, just trying to work with them and folks in their organization about ways that they could, you know, help to address some of the challenges that we identified and work more closely with the Public Health Agency. So we did engage with a number of federal partners in that space. Um, I think the circle can always be broader. So I don't know if we necessarily met, for example, with the organization that was described there in terms of Immigration, Refugees, and Citizenship Canada, but we did meet with a number of federal agencies that were doing work in this space and try to identify ways to, you know, coordinate a bit better what's happening at the federal level and facilitate the data assets they have getting into the hands of people across the country for public health surveillance.
I'm going to skip one question, just go to another one that came in because I think it builds on what we were just talking about, and I'll come back to the other after. Will there be ongoing ways of providing feedback for those who participated in the consultation and the work in surveillance between now and 2030?
Oh, what a great idea. I well, I don't know, to be honest. I mean, there are the usual channels, obviously, where the people that did this work, and myself included, but you know, the Public Health Agency of Canada are very open to feedback. So this falls under the authority of Dr. Sarah Viebeck, who is the vice president in this branch and the chief science officer. So always open for feedback there. But in terms of specifically on the vision, I think that's a really good message I can bring back to think about that. I mean, there have been some informal venues, I would say, where we've made presentations and gotten feedback. And I do know that work is underway, certainly with the Public Health Data Steering Committee. It is on their agenda to come back to this periodically and look at what's happening in terms of activities vis-a-vis the vision. So there is a bit of a, you know, it's not really kind of a, wouldn't say it's a periodic evaluation that's been planned, but there is an intent to keep looking back at this while it remains relevant and sort of, you know, marking progress against it. But in terms of feedback of those that took part, I think that's a really great point, and I'll be sure to bring that back to my colleagues at the Public Health Agency.
Excellent. Thank you to the person who asked that question. The next question is Public Health Ontario planning to lead operationalizing Vision 2030 at the provincial level, especially those focusing on collaboration, governance, and interoperability? I will just say briefly, and feel free to follow up with me afterwards if anyone has interest or questions. As part of our strategic plan at Public Health Ontario, one of these is around data and how we can really leverage data for making policy and practice decisions. Within Ontario, we are very closely connected with Dr. Vbeck at Public Health Agency of Canada, and we'll certainly be working with our partners in local public health in order to advance work in this area. I wanted to ask you a question, David, around you had the opportunity to speak to a number of international jurisdictions as well as part of this. And I'm really curious about, based on your discussions with them, what assets do you think we have in our current surveillance systems in Canada that we can really build on to get to that future state?
Oh, that's a good question. You know, it's interesting. Many of our countries that we reached out to, which for example, United States, England, and Europe, some in Asia as well, we're going through different degrees of political change, I would say, which it's sometimes hard to separate. And of course, post-COVID, I think a lot of people were in that frame of, I wouldn't say fatigue, but just kind of oh, we've been there, we've been through a lot of this. Do we really have to keep talking about this? So there was a bit of that. Um, but what I think is different for us. So I think we have some of that too, obviously. We had an election, of course, and we all worked very hard and are still working very hard in public health. Um, we have highly skilled people in Canada. That's one thing that we have, that like a real mass of people in public health. And I think, there's been differences in how the public perceives public health, obviously, in the context of what happened during the pandemic. But I think ultimately people in Canada really believe in the collective good, which is sort of where we're trying to get to here, right? So, and even in fact, I think that just the agreement across the people that we talk to in terms of where they want to get to and how important they see this, and the fact, for example, bringing the social determinants of health into our public health surveillance in a more systematic way. The support for that was almost universal, really. So I think there is very good and well-trained people. I think a reasonable amount of shared values and consensus. And we do have, believe it or not, fairly good data. Sometimes it's just hard to get access to it in the timely manner, and it's hard to get it in the right format. So I always feel like we're almost there in many ways, So, and there are a lot of things happening. So maybe I gave you too many things there, but my sense is there's a lot of good things going on here in the country compared to other countries in public health and public health surveillance. So I think we're actually well poised to move towards this vision. It just takes leaders such as yourself and others to, keep the momentum, and help us to go in the right direction.
What a nice note to end on. I think that, we've got a vision now, we've got skilled people, and we've got willingness across the country. And with all of that, certainly sets us up for a positive future. With that, I want to say a huge thank you, Dr. Buckridge, for presenting and having this conversation with us. I'd like to thank all of our attendees for joining today's event. As always, you can expect to receive a brief and anonymous survey for the session, and please do try and complete that. It helps us improve our programming. Thank you so much to everyone who joined, and I wish you a wonderful rest of your day.